Hi, this is Dr. H again on Friday, March 27th at around noontime Pacific time, giving you, I guess, one of these daily updates on the real data. I think that this is the most important thing for us to remember is look at the data and compare it apples to apples. So let's do that. I think I've said before that the key numbers that we should be looking at are death rates per population, not by country, but by population, as well as doubling rates, the doubling of death or mortality in every given region or collectively. I think those are the most important, because when you look at the number of cases, we now know that the United States is the number one country in the world with numbers of cases. But yet when you validate that to the population and you compare the 8 top countries in Europe to the United States, while we have, I think, 86,500 cases reported, that same population has 256,000 cases reported throughout Europe. So roughly, for the same population, we in the United States are at 1/3 the number of cases collectively, and yet that number is simply a function of the number being tested. So let's look at the death rates. So when you look at, we have our total today is 1,321 in the United States, but when you look again at populations in Europe that are similar for the top 8 countries, which includes France, Germany, Italy, etc., they have a total of 360 million people, roughly similarly about 10% more than the United States, and yet they have a total of 18,700 deaths versus our 1,300, so roughly about 10 to 15 times more, relatively speaking. So while that number is important because in Europe, they're about 7 to 10 days, in terms of Italy, about 2 weeks ahead of us. But this is, when you compare us to Italy, for example, where Italy was 10 days ago is where we are today. Ultimately, they went up from 1,300 to 8,200 as they are today. So roughly we could expect, if we have a similar path, we could expect in the United States to be roughly at that level in 10 days, and perhaps in 2 weeks it would be a little bit higher. But when you look collectively at all of Europe, which is roughly a week ahead of us, we could expect theoretically to have up to 18,000 deaths in the United States total. It is a function of what happens in our clusters, so to speak. The biggest cluster, or almost 30% of all the cases in the United States, are in New York State. But the most important thing here is to make sure you look at the numbers relative to populations and relative to doubling rates. So we are now doubling every 3 days, but that's equivalent to all the countries except Italy and Iran, who had the doubling rates this way and then have a slowing of their doubling rates to now every 6 to 7 days. So the countries that have had exposure for longer periods of time are now doubling at half the rates, basically. So that's a good sign for us going forward. When you look at the dire predictions that I wrote about, where 500,000 people will die and so on, I think that they've been downsized even by the statisticians. The one in the United Kingdom downsized from 500,000 deaths to 20,000 deaths, so that's important. The last thing I want to talk about is the second wave. Again, today, as in the last few days where I've reported, there is still no data to suggest a second wave in the Asian countries of China, Korea, and Japan. In Korea, they've had 29 additional cases in the past week, but that's really going from 100 to 130 cases, which is still amazingly low. In Japan, they have 12 new cases, and all of China with 1.4 billion people have had a total of 40 new cases. So for 1.5 billion people on Earth, there have been an additional 90 cases, and these are countries that are 1 or 2 months ahead of us. So right now there's no evidence for a second wave, and I'll next report on Monday, on I think Monday the 30th. I wish everyone a great weekend and blessings, and our hearts go out to everyone who's suffering, and our blessings go out to all the healthcare workers, all the essential workers that are doing unbelievable work to allow us to function as best we possibly can. Take care and bye-bye.